Here is my 360 of the room, my stand, my supplies, my patient. All right, turn around. All screens are off. No papers sitting out. Alrighty. Hi, my name is Ryan Bates. I'll be performing an abdominal assessment on you today. How are you feeling? Good. Awesome. First, I'll start with this inspecting. I'll look from the top and the side. First, I'm gonna look at your skin, your contour, and any pulsations. Your skin is pink. I don't see any scars or striae. I'll look at both sides. I don't see any dilated veins, ecchymosis, which is bruising, or rashes. That's all normal. Contour-wise, you have a flat abdomen. It is symmetric. Your umbilicus is midline. I don't see any bulging anywhere around your abdomen or by the umbilicus. No inflammation and no visible masses. As for pulsations, I don't see any visible peristalsis, but I might see a slight pulsation, and that's just your heart beating through your aorta, which goes down through your belly. Next, I'm going to listen to your abdomen. I'm going to start down here, work my way around, and I'll listen to a couple other things. First, what I'm going to do is I'm going to listen using the diaphragm of my stethoscope, which is the big piece. I'm going to start in your right lower quadrant, and I'm going to listen to your bowel sounds. I'll do this first before I inspect or do anything else because I don't want to cause any extra sounds by kind of moving everything around, and I won't push too hard. So we'll start down here in the right lower quadrant. Then we'll move to the right upper quadrant. The left upper quadrant. And the left lower quadrant. Alright, I heard a little bit of tinkling and gurgling out of a normal active rate, which is pretty normal. Next, what I'll do is I'll listen using the diaphragm still. I will use that, and I will listen over your liver and spleen just to listen for any signs of inflammation, which would be like a friction rub. Don't hear anything over your liver. Let's check your spleen. And no friction rubs over your spleen. Everything's normal so far. Does not want to turn today. Next, what I'll do is I'll listen for any just different pulsatile or kind of like a different sound in the vessels that go throughout your abdomen that could kind of tell us something's wrong with blood flow. I'm going to listen over your aorta, which is going to be about halfway between your xiphoid process and your umbilicus. I'm using the bell of my stethoscope to listen for the bruits. Nothing on the aorta. Next, I'll move about 1 inch laterally, which is going to be your renal arteries. Left sounds good, and right. Right sounds good, and then I'll move down to your iliac arteries. Those split off of your abdominal aorta, and they are about 2 inches below your umbilicus on either side. I don't hear any bruits in the iliac arteries. And last is the femoral arteries, which is right above where your legs branch off, okay? So I'm just gonna kind of feel and listen right there. Still using the bell of my stethoscope. And then lastly, for this, I'll listen over your umbilicus for any venous hums. I don't hear any venous hums. Everything sounds great. Next, what we're going to do, or what I'm going to do, is I'm going to do some percussion of your abdomen, and this just kind of tells us what's underneath, whether it's like a solid organ, a hollow organ, fluid, air, anything like that. Normal sound is tympany, which is a little higher pitched, and I'll start up here, and I'll work through the 9 quadrants, 9 regions. First is going to be your right hypochondriac, and I'll just do a gentle, like, for percussion, okay? And then your hypogastric, your left hypochondriac, your right lumbar, your umbilical, your left lumbar, your right iliac, your hypogastric, and your left iliac. Awesome. I heard tympany in all areas. That's great. Next, what we're going to do is I'm going to measure your liver span using the same technique. I'm going to go down and I'm going to up, and once I hit that certain sound I'm looking for, I'll mark it and we'll measure it, okay? So I've got my measurement tape and my marker here. I'm going to work my way down along like the mid-axillary line is what we like to kind of go off of for this, kind of like how I listened in those 4 quadrants earlier. So I'm going to start about here. Your resonance over your chest. And then your liver is going to be more of a dull sound. Just see right about there. And it is a little bit under your rib cage. Our diaphragm stretches up into our chest cavity. Why later I'm going to have you hold your breath for a couple things because it'll help displace your liver into the abdominal cavity more. There we go. I'd say it's right about here. Not a very straight line. And then we'll measure it. And it looks like I'm going to measure down. We're at 5.5 centimeters, which is about a normal liver span. It's usually about 60 to 65% accurate from what the textbook says, but normal for a mid-clavicular liver span is like 6 to 12 centimeters. And next, I'm going to percuss your spleen. What I'm going to do for that is I'm going to have you take a big deep breath, and it's going to stretch out that diaphragm, and we're going to displace your spleen down, and I'm going to percuss along the anterior axillary line, which is defined as where your pectoralis major meets your axilla. Trauma surgeon taught me that at the cadaver lab. He was on one that day. But anyways, I'm going to do the anterior axillary line just to kind of see. What we want is, there's resonance throughout, which is great. We don't want any type of dullness or anything that could mean like an enlarged spleen. But we heard that resonance or tympany, which is normal for that. So next what we're going to do is we're going to move on to the palpation. So I'm going to do light, deep, and then I'm going to move from your liver, spleen, and kidneys, and then we'll do a couple other things, okay? So what I'm going to do first is just light palpation, and that's just me with one hand kind of moving around your abdomen, seeing if there's any tenderness, any superficial masses, anything like that. I don't feel anything so far. Are you having any tenderness?
No.
Okay. And this one's just very light, not very deep at all. And that, I didn't find anything on that exam. Next what I'll do is deep palpation, which is I have to use both hands and I go about 2 to 3 inches deep. For some people it's a little different. On our thinner patients, we don't have to go so crazy far, but the idea is that you get in there deep enough to kind of feel around and see if there's any abnormal masses around the organs, okay? So I'll do usually about 4 regions, and I'll avoid this area, which is your aorta. I don't want to compress on the blood vessel that's delivering blood to the bottom half of your body. So first we'll do 2 hands. We'll start over here. I know it could be kind of tender or ticklish. I'm very sorry. The idea is that we get in there enough that we can determine whether or not there's anything different. And if there was any pain with this, that would be another concern. Were you having any pain?
No.
All right, awesome. So we did light, deep. We're going to do liver now. I'm going to have you take a big deep breath. I'm going to kind of help support from the back here, just so I can hook my hand underneath and I can feel along the edge of your liver, see if it's enlarged, see if there's any weird hard spots on it, anything like that. So take a big deep breath. I'm going to kind of hook, and I'm sorry. I do feel right under your ribs here. I can feel along the edge of your liver. Feels soft. There's no hardness, no like irregularities along the edge. It can be a little tender. Are you having any tenderness?
No.
Okay. Can be a little tender on palpation sometimes just because of how we have to do it. Next is your spleen. I'm going to have you take another big deep breath, and I'm going to kind of do the same thing on the other side and try and kind of palpate your spleen. The spleen is usually not palpable just because of the location and size. No pain or anything. Okay, good. I can't palpate your spleen, but that's normal. Next, we're going to go kidneys. I'm going to go farther under this side. I'm going to press down right here. And your kidneys are actually on the back of your abdomen in the retroperitoneal cavity, which is just kind of like behind everything. And they're kind of hard to palpate too, and I don't palpate any. I just kind of feel and test it at this point. Do the same on this side. Support and using a biomanual technique. I'll try and kind of palpate on there. Any pain or anything?
No.
Good. There's that. I don't feel either your kidneys, which is normal, your spleen I couldn't palpate, which is normal. Didn't palpate any masses or anything. And then your liver is of normal size. So while I've got you laying like this, I'm going to do a couple things. First, I'm going to do some more percussion. But I'm going to do it in an outward direction to see if there's any like fluid. Any shifting dullness could potentially mean you have ascites. I wouldn't know it by looking at you, but just because usually acidic patients they have a larger belly full of fluid just because of the poor circulation through the liver and the fluid backs up. So I'm going to start in the center here, and I'm going to percuss outward. What I don't want to find is any shifting dullness. I didn't hear any dullness, so that's great. Next is going to be a couple signs for appendicitis. First one's the Ross veins. I'm going to press down deep over here and pull my hand out. And if you had appendicitis, you would have pain on this side. It's called rebound tenderness. So I'm just going to deep palpate over here. Any pain?
No.
And then I'm going to let out. Any pain?
No.
All right, great. Next, we're going to use your leg. Kind of have you pull up this leg, bend your knee a little bit, and then push against my hand. All right, good. There's a muscle down here called the psoas muscle. You can relax that. The appendix lies down here, and it can irritate the lining of the abdominal cavity along with that muscle. And using that muscle is the same thing as when you're flexing against my hand. And so if you were to have appendicitis, that would be very painful because that muscle is irritated. Next, I'm going to have you do this. That was the psoas sign. That was negative. That's great. This is the obturator sign. I'm going to have you internally rotate your leg. And are you having any pain?
No.
Awesome. Great. So that was a negative obturator sign. Next is for cholecystitis. Take a big deep breath for me, and I'm going to palpate your liver edge. And if you were to have any pain, and then let out. Okay. Any pain?
No.
All right, now breathe in. All right, good. If you were to have pain that stopped with inspiration as I was palpating, that would be a sign of cholecystitis, or your gallbladder would be inflamed. But you didn't have any pain at all, which is great. Last thing I'm going to do is I'm going to have you kind of rotate and sit up so I can expose your back real quick. And this last thing is going to be checking for any pyelonephritis, which is like an infection of your kidneys. So I'm going to find your costovertebral angle, which is where the last little rib meets the spine. And that's going to be right here. Right there. So on the left, I'm going to put my hand against here, and I'm going to gently pound my hand. And you're going to tell me if you have any pain, okay? All right, 1, 2, 3. Any pain?
No.
All right. And then on the right side, 1, 2, 3. Any pain?
No.
All right. I'm going to do it again on this side because I didn't do it very hard the first time, okay?
Mm-hmm.
1, 2, 3. Any pain?
No.
All right, great. That's negative for any like pyelonephritis signs. That sounds great. You can go ahead and have a seat. And then I'm just going to make sure my face was in here.